we have to take care of our patient because we don't know, maybe his patient is in attack, so I have to look for the patient. He is okay, he is panic, he is like shortening of breath or whatever, so I have to be careful, and I think he is fine now. Okay, now after that we are going to go by applying alcohol to the side of electrodes. Why we apply alcohol? Because we need to clean the skin. Of course, maybe we have our patient is clean, but we don't know. Maybe like during the traffic, during whatever, gets wet, so adhesion will be no perfect. And we know that from your experience that we are going with the side of application. We apply first to the limb electrodes anywhere in the body, upper or lower left. And as you know from our experience that 30 seconds will be enough to give dryness of the alcohol. And by the way, also we applied alcohol to the sides of how to press the electrodes here. We have approximate the V1, the V2, the V3, V4, V5, V6. So we apply alcohol to prevent bad adhesion, and we give time. After that, as you know, we have 10 electrodes. If you forget like how to go the number 10 or 12, the paper is already ready. 10. So if you have bad memory, so 10 electrodes. The point is for electrodes, like for the lamp, it has to be like this dome should be down, look down. You see? And other one. And for the lower limb, it should look up. So all should be facing each other. So for the lower limb, the dome shape of the sticker should be look up. And for the upper limb and for the chest electrodes or precordial electrodes, we have to apply down. The technique, as I told you, how to go by the intercostal space. As you know, this is the clavicle. If I put my finger here, I find that there is a space. It is not actual space, but the intercostal muscle. So I put finger here, and the second finger and third finger. So this will be first intercostal space. Second will be second rib, and this will be second intercostal space. Put your fingers and move 3 fingers again. Second intercostal space, third rib, third intercostal space, another landmark. Third intercostal space, fourth rib, fourth intercostal space to the right of the sternum. So I am here and the right of the sternum. And I will start to apply the electrode, sorry.
And those ones go up or down?
Yes. Take it. Okay. And after that, we are going with V2. And as you know from previous description, that V2 is the same location. If I am accurate from the beginning, so I can go like I'm saying all the time, cross the street. If I am not accurate, so I have to repeat the procedure. I will find the clavicle. I will go by 3 fingers at this one time. This is the second time, and this is the third time. So this will be V2, which is to the left of the sternum. Here, after that, I told you we postpone V3 for a while, and we go by V4. Where's V4? It is the apex of the heart. It is 5th intercostal space to the left of the sternum at mid-clavicle line. This is very important. Everyone going with EKG has to know where is the apex of the heart. So again, I am going. So instead of going by 3 fingers 3 times, I will go by 3 fingers 4 times. So here, the intercostal space, so this number 1, After that I go second time. After that I go third time. After that I go fourth time. So this will be V4. This is the clavicle midline, so it will be like this. So the meeting of fifth intercostal space to the left of the sternum with the mid clavicle line, this will be V4. What about V3? It is a time to go by V3, which is midway between V2 and V4. So this is the midway. I have to imagine that this is like the line. So again, V1, V2, V3, V4. What about V5? V5 is located in the fifth intercostal space to the anterior axilla line. If you attach the angle of the axilla, so this is the angle of anterior axilla line, so this V5. What about V6? V6 will be the same level as fifth intercostal space, but in mid axilla, so like he abduct his hand. So this is our technique. So this is how to go. After that we have to wire. Connect the electrodes by the wire. Okay, can we get it out? Okay, from our knowledge, what do you think, how many wires? 10, because we have 10 electrodes, so we have 10 wires. 4 of them are long for the limbs, and 6 of them are short for the precordial electrodes. Okay, so let us attach and be careful. If you misconnect, you will get wrong direction of the wave. As you see here, we have the landmark. This say what? LL. You see? LL. So this means what? Left leg. So left leg of the patient, not left leg regarding you. So this is the right leg of the patient. This is the left leg of the patient. We connect it. And the second one here, we have what we call RA. Means what? RA? Right arm.
I was trying to raise my hand, sorry.
Right arm of the patient. Again, because sometimes we get confused, the students, and connect according to their direction. No, according to the patient direction. And this is what we call LA. Means what?
Left arm.
Left arm. Left arm. We connect it to the left arm. And the last one here for the limb, it is RL, means right leg. We connect it to the right leg. So we finish connection with the limb electrodes. The remaining are precordial electrodes. The precordial electrodes, you have to be aware that not be like overlapping, not like kinked, as much as you can. Let us go here. You find that this one is V4. V4. So where I have to attach V4? Here. This is V4. You remember? Which is the apex. Okay. And this is what? This is V6. Who attach this? V6. This is what?
Jenny, I'm joking. No,
sorry.
it didn't hurt. It didn't.
You
I was
are.
joking.
I heard you.
No, it was a joke. I'm sorry.
Attach it to V1.
I'm sorry, Jenny. I'm sorry.
And this is V2. Okay, attach V2. Correct. Okay. Due to the presence of hair, so we will attach surgical tape. V5. Who will connect V5? Anyone? Anyone? V1, V5, and V3.
Careful, Jenny.
Okay.
Very good. So we have to be sure that everything is like sticky. Perfect. Except this one, we have to have. Give me surgical tape, please.
Do you use like tape, or do you use do you have to shave them?
Yes, we use surgical tape to be wide. Get me, please.
That's enough. You need more.
It's okay. Thank you. Now we are done with connecting, and this is your major job. As a medical assistant or EKG technician, you have to do this job, very important, and we are away from the wall.
Wow.
After that, we have the setup, and the setup is different from machine to machine, and we are going with the machine and go enter the patient data, age, height, weight, sex, race, and patient ID number. And after we enter everything, we find that we are ready to push the button for EKG. So you find that do analysis. For sometimes you have give information to the patient not to move, not to talk, not to turn your face, and after that you find that the machine starts to print immediately. Okay, we will pause now until put the data, and after that we connect. Okay.
What did you So you look like you're getting a nap in.
I'm trying to relax.
You okay, Daniel?
Well, you're recording me. I don't know why you're doing this.
It's for educational purposes.
That's what you say when
You're such a good sport.
Do you really keep all these videos on your phone?
Yeah.
As you see here,
What happens when you don't have kids? Our albums are
if you
full
go
of
to the machine here, we have to put the name. So we start by name. As you see, guys, we mentioned here, it gives me information that the speed of the machine is 25 millimeter per second. You see? Which is very important. Before you start, you have to be sure that the machine speed is
25.
identical, okay? Which 25 millimeter per second.
In the hospital, do they use this machine or they use something different?
Use this machine, some hospital and clinics, and if you are working with Kaiser, you find that they have more bigger machine, more advanced machine. So, but the same principle, okay?
You don't even have to type. Match that
okay.
the medical record number and everything comes up. That's real.
So to give me the information, new patient, I will say yes. Last name, Daniel, for example.
That's Robert, right?
My last name?
And first name. And then we go enter. So patient ID, if he has number for operation code, is the same. I'm not doing. Okay, we give age. Age is
40.
40?
Mm-hmm.
Okay, 39. Okay. Weight, what about the weight?
250. 250 for my weight.
10, 15?
250
215?
for my weight, right?
Okay. Okay.
Was that Lauren calling me an elephant?
Oh, no.
And, no, no. And we have here option like you have to mention the medication. Maybe the patient is already receiving beta blocker or the patient is receiving antihypertensive medication. So you have to mention what is the medication the patient is receiving. If the patient has no medication, because the patient is still talking for a while. All of these are
Sloppy.
artifact because he is. It is print immediately. See?
Like, relax, Daniel. Darn. What's going on? What you got on?
Don't move.
What you got pierced?
Don't worry. All of these are artifacts. Say what? You see? Muscle. Muscle what? Tremors. You feel cold?
No, he was moving.
It just was moving. So you find that the machine tell you that muscle tremors. So of course all of this is example for, you can separate it for everyone.
So, like-
this is for like
Should I, like, you're touching me, is that, like, bad?
You have your
Don't
watch
touch,
on,
like,
doctor?
hmm?
You have your watch on?
Okay, so keep
Oh, yeah.
relax. And the machine giving you the information that the rate of heart is 93, 92, it is moving.
I was just asking.
Slow down.
Yeah, relax and slow down.
You see, it is going down.
Deep breath intake.
Analyzing. We get much better result, of course, but still we have artifacts. This artifact is still, there is a muscle twitches, you see?
Well, then don't you have to make him sit on his hands?
Muscle
then?
twitches. Okay, try to be rest again.
No, muscle twitches aren't. I don't feel twitchy.
Don't talk.
The same.
Much better. Okay, we will make copy and give it to everyone, okay?
Okay. It's probably all the
Thank you,
caffeine I've been
Daniel.
drinking.